The member for Goldstein.
Thank you, Speaker. Speaker, my question is to the Minister for Health. Will the Minister update for the House the Morrison Government's health response to the coronavirus pandemic?
The Minister for Health.
Thanks very much, Mr Speaker. And I want to really thank the member for Goldstein for his question, but also for the initiative which he, along with other members in this chamber on both sides, have taken to support local communities by encouraging community groups and assisting them as they support older Australians or isolated Australians. I think it's been an immensely human and important move, and it's been one that people on all sides are pioneering and practising in their own electorates. The central approach within our health response, as I mentioned earlier, is twofold. One is to reduce the rate of infection or to help contain the virus, and then secondly to increase the capacity. In terms of reducing the rate of infection, there are four core elements. One there is what we are doing with regards to the ring of steel around our borders. That is well known. Two is our testing regime, which is at the global forefront. Earlier today, the figures provided by the National Incidence Centre were 313,000 tests so far and a positive rate of just under 2%. What that actually means is that we are testing widely and broadly, and that we are getting a representative outcome from our testing. It allows us then to go to the third element, which is the tracing, the contact tracing, and finding all of those who have been in contact and therefore are most at risk. This is about ensuring that the thing which the Prime Minister and Professor Murphy talked about yesterday of reducing cases in the community, of reducing these community transmission cases and finding them and mopping those up, is given the best chance forward. And the more we can do that, the further we can reduce the rate of infection. And then, of course, perhaps most importantly of all, is the social distancing and self-isolation which Australians have been practising magnificently. We have all sadly seen in our own electorates what that has meant in terms of normal engagement and what it has meant with regards to the way we've been able to go about our lives. But what is so contrary to our nature is so fundamental to our future. So those actions which Australians are undertaking, and which I know they will continue to undertake over Easter, are saving lives and protecting lives. Each one of us can save a life by isolating and maintaining our distance. At the same time, we've been boosting our capacity, as I mentioned earlier. One particular feature, which is immensely important, is bringing universal telehealth online. 2.5 million services already. We have transformed the way medical primary health has been and is being delivered in Australia. That's protecting our doctors and our nurses, it's protecting our patients, and all of these elements are coming together as we flatten that curve, as we increase our capacity, and as we work together to save lives and protect lives.